Our next speaker is going to talk to us a little bit about erythrocytosis in adolescents who are receiving testosterone. So this should be very interesting too. And it's Rachel Seifert and Dr. Mihalopoulos.
Hi, thank you for having me. So today I'll be talking about the risk of erythrocytosis in adolescent transgender males using gender-affirming testosterone therapy. So it's estimated that nearly 2% of all high school students identify as transgender, and some of these will seek gender-affirming healthcare. So it's important that they have information available in order to make evidence-based informed medical decisions. For trans males or people assigned female at birth who identify as male, testosterone is often used to masculinize the body. And we know in adult transgender populations that that testosterone therapy has been associated with erythrocytosis, or an increase in the red blood cell content of the blood measured as the hematocrit lab value, and erythrocytosis specifically referring to an increase above the upper limit of normal, so an abnormal increase in hematocrit. And this is significant because in general populations, erythrocytosis has been associated with adverse medical events, including particularly thromboembolic events and cardiovascular events, so strokes, heart attacks, clotting. And while testosterone has been shown to increase erythrocytosis in adult transgender populations, there is a paucity of research in the adolescent transgender population. And so the purpose of this study was to look at how testosterone affects hematocrit in the transgender adolescent population. And here you can see the demographics of the participants. Participants started testosterone between 13 and 23 years of age. And notably, all of our participants were white and non-Hispanic. And in the first graph, you can see that there was a significant increase in hematocrit over the first year of testosterone use. And between the first and second year, there was a non-significant change in hematocrit. And in the second image, you can see erythrocytosis, so how many participants had hematocrit levels beyond normal. And initially, at baseline, none of our participants had erythrocytosis, but after 1 year, 10% had developed erythrocytosis, and after 2 years of testosterone treatment, 20% of individuals had erythrocytosis. We also wondered about the extent to which testosterone dose impacted this change in hematocrit. And as you can see in the first graph, testosterone dose did increase throughout the 2 years of testosterone use. And as you can see in the second two images, the correlation coefficient between testosterone dose and hematocrit only suggested a weak correlation. So in looking at previous literature, to the best of our knowledge, no prior studies have trended hematocrit values across 2 years in this population. And no prior studies have described the extent of erythrocytosis in this population overall. And so in conclusion, this study really shows a substantial risk for erythrocytosis in adolescent transgender males. And it's important that patients and providers have access to more information about this. And for clinicians practicing, it's important to monitor for erythrocytosis and consider comorbidities that may lend additional risk for adverse medical events, and consider referring to hematology in rare instances. Future directions of this work. So it's important to correlate the increase in red blood cell content to adverse medical outcomes. This is an ongoing question, particularly within the adolescent population, but also within the adult population. Additionally, it's ultimately important to have studies with larger populations, longer follow-up times, and diverse participants to fully understand this. Thank you so much for having me.
She'll be available to answer any questions